A new study has uncovered a concerning link between late motherhood and an increased risk of breast cancer. The research, conducted on nearly 50,000 women, suggests that women who delay childbirth until after 30 and experience significant weight gain in their 20s face a significantly higher risk. This finding highlights the complex interplay of age, weight, and reproductive factors in breast cancer development. It underscores the need for greater awareness and proactive measures to mitigate risk. The study involved an extensive analysis of data from nearly 50,000 women. These women were carefully selected to represent a diverse cross-section of the population, ensuring that the findings would be broadly applicable. The data collection process was rigorous, involving multiple stages of screening and verification to maintain the highest standards of accuracy and reliability. Participants were tracked over several years, with periodic follow-ups to monitor changes in their health status. This long-term tracking was crucial for capturing the dynamic nature of health and disease progression. The researchers employed advanced statistical techniques to analyze the data, allowing them to identify subtle trends and patterns that might otherwise have been overlooked. Researchers collected detailed information on each participant's reproductive history, including the age at which they had their first child, the number of pregnancies, and any complications experienced. They also monitored weight fluctuations, recording changes at regular intervals to assess long-term trends. Additionally, the incidence of breast cancer was meticulously documented, with medical records and patient interviews providing comprehensive data. This large sample size and longitudinal approach allowed for a robust assessment of the relationship between late motherhood, weight gain, and breast cancer risk. By including a diverse group of women, the study was able to account for variations in genetic background, lifestyle, and environmental factors. The longitudinal design provided a unique opportunity to observe how these factors interacted over time, offering valuable insights into the mechanisms underlying breast cancer development. The researchers meticulously controlled for other factors known to influence breast cancer risk, such as family history, lifestyle habits, and socioeconomic status. They used sophisticated statistical models to adjust for these variables, ensuring that the observed associations were not confounded by other influences. This rigorous approach enhanced the credibility of the findings, providing a solid foundation for future research and public health interventions. This approach ensured that the observed association between late motherhood, weight gain, and breast cancer risk was not simply a result of other confounding variables. By carefully accounting for these potential confounders, the researchers were able to isolate the specific impact of late motherhood and weight gain on breast cancer risk. This level of precision is essential for developing targeted prevention strategies and informing clinical practice. The findings provide compelling evidence to support this concerning link. They highlight the importance of considering reproductive history and weight management in breast cancer prevention efforts. The study's robust methodology and comprehensive data collection make it a valuable contribution to the field, offering new insights and guiding future research directions. These results underscore the need for personalized approaches to breast cancer risk assessment and prevention, taking into account individual reproductive and weight history. The study revealed that women who gave birth after 30 and experienced significant weight gain in their 20s were nearly 3 times more likely to develop breast cancer compared to women who had children earlier and maintained a stable weight. This alarming statistic underscores the importance of understanding the combined impact of these factors. While the study does not definitively prove causation, it strongly suggests that delaying childbirth and gaining excessive weight during young adulthood may create a physiological environment that promotes breast cancer development. This information is crucial for women as they make decisions about family planning and lifestyle choices. A previous research has indicated that early pregnancy can have a protective effect against breast cancer. This protection is thought to be linked to the hormonal changes that occur during pregnancy, which may help to mature breast cells and make them less susceptible to cancerous transformations. However, this study suggests that this protective effect may be diminished or even negated in women who experience significant weight gain in their 20s. This finding emphasizes the complexity of breast cancer risk and the interplay of multiple factors. Section 5. Excess weight, hormones, and cancer growth, a dangerous cycle. In this section, we will delve into the intricate relationship between excess weight, hormonal imbalances, and the increased risk of cancer, particularly breast cancer. Understanding this cycle is crucial for taking proactive steps towards better health. Excess body fat is known to increase the production of estrogen, a hormone that can fuel the growth of some breast cancers. Estrogen is naturally produced in the body, but when there is an overabundance due to excess fat, it can lead to a higher risk of cancerous cell growth. This is particularly concerning for women who are already at risk due to genetic factors or other health conditions. When women gain a significant amount of weight, particularly during young adulthood, it can disrupt their hormonal balance and create an environment that is more conducive to cancer development. This weight gain can lead to a cascade of hormonal changes, including increased levels of insulin and insulin-like growth factors, which have been linked to cancer progression. The disruption in hormonal balance is not just a temporary issue, it can have long-lasting effects on a woman's health. This hormonal disruption, coupled with the potential loss of the protective benefits associated with early pregnancy, may explain the increased breast cancer risk observed in the study. Early pregnancy is known to offer some protective benefits against breast cancer, but when hormonal balance is disrupted by excess weight, these benefits may be diminished or lost entirely. This makes it even more important for women to be mindful of their weight and hormonal health throughout their lives. Maintaining a healthy weight throughout life is crucial for hormonal balance and overall health. Regular physical activity, a balanced diet, and routine medical checkups can help manage weight and keep hormones in check. By taking these steps, women can reduce their risk of developing breast cancer and other health issues related to hormonal imbalances. It's never too late to start making healthier choices, and the benefits can be significant for both short-term and long-term health. Section 6. Expert Opinions Insights from the European Congress on Obesity. Experts at the European Congress on Obesity have expressed serious concerns about the link between late motherhood, weight gain, and breast cancer risk. They emphasize the need for greater awareness among healthcare professionals and women of reproductive age. They stress that while women cannot control all risk factors for breast cancer, maintaining a healthy weight through diet and exercise is a modifiable factor that can significantly impact their risk. Empowering women with this knowledge is vital for early prevention. Section 7. GP Awareness, a crucial element in breast cancer risk management. General practitioners, or GPs, play a vital role in educating women about breast cancer risk factors and promoting early detection measures. They are often the first point of contact for women seeking health advice, and their guidance can be instrumental in encouraging healthy lifestyle choices and timely screenings. GPs are uniquely positioned to influence their patients' health decisions. They can provide personalized advice based on individual risk factors, such as family history, genetic predispositions, and lifestyle choices. By fostering a trusting relationship, GPs can ensure that women feel comfortable discussing their concerns and are more likely to follow through with recommended screenings and preventive measures. Staying updated with the latest research on breast cancer is crucial for GPs. This includes understanding new findings, such as those presented in recent studies, and integrating this knowledge into their practice. By doing so, they can offer the most current and effective advice to their patients. GPs should also be proactive in discussing breast cancer risk factors during routine checkups. This can include conversations about the importance of regular mammograms, self-examinations, and lifestyle modifications that can reduce risk. By addressing these topics regularly, GPs can help normalize the conversation around breast health and encourage women to take an active role in their own care. Additionally, GPs can provide resources and support for women who may be at higher risk. This can include referrals to specialists, information on genetic testing, and support groups for those who need it. By offering a comprehensive approach to breast health, GPs can ensure that their patients have access to the best possible care and support. In conclusion, the role of GPs in breast cancer risk management cannot be overstated. Their ability to educate, support, and guide women through their healthcare journey is invaluable. By staying informed and proactive, GPs can make a significant impact on the early detection and prevention of breast cancer, ultimately saving lives and improving outcomes for countless women. Section 8. Self-checking for breast cancer. Empowering women with knowledge. In addition to regular checkups, it is essential for women to be familiar with their breasts and aware of any changes. Performing regular self-examinations can help to detect abnormalities early on, when treatment is most effective. Women should be taught how to perform self-examinations properly and encouraged to report any unusual findings to their doctor immediately. Early detection is crucial for improving breast cancer outcomes. Section 9. Prevention and early detection. Your best defense against breast cancer. While the link between late motherhood, weight gain, and breast cancer risk is concerning, it is important to remember that this is just one piece of the puzzle. Many other factors influence breast cancer risk, and there are steps women can take to reduce their overall risk. Maintaining a healthy weight, engaging in regular physical activity, eating a balanced diet, limiting alcohol consumption, and getting regular checkups are all crucial components of a proactive approach to breast health. Early detection remains the